It's the dawn of a new decade. You can be you again with mini dental implants. Do you suffer with loose dentures? Are you embarrassed to smile because you're missing teeth? Mini dental implants will change your life.
I've had problems with my teeth.
I couldn't eat almost anything.
I had this big hole in my mouth.
I knew it was time to do something permanent.
I'm gonna go and get this done.
It's just unbelievable what it's done to my life.
I feel like me again.
It'll be the best, smartest move you ever made.
Kind of gave me my life back.
The mini implants are the only way to go.
Just real happy I did it.
I would recommend it to anyone.
Do it over in a heartbeat.
It's been great.
It's incredible. It is. It's absolutely incredible.
Hello everybody, I'm John DeSciullo. Welcome to Innovations in Health. We're talking about the mini dental implant, and I'm welcoming Dr. Thomas Brown from Family and Sedation Dentistry. Welcome to the show, Dr. Brown.
Thanks, John.
You know, the mini dental implant procedure is so revolutionary. It's 5 times less invasive, less pain and discomfort, less healing time, less visits to the dentist, and less expensive. And you can be you again. Imagine biting into the food that we love here in Illinois, the deep dish pizza, the juicy steaks, an ear of corn, an apple, all of those great foods. You can be you again with the mini dental implant. It's FDA approved. It's a made in America product. Dr. Thomas Brown, I know the mini dental implant procedure is so different than the conventional. Show us with the model you have in front of you.
Yeah, the conventional implants have a larger size hole. They have got to have a big one in order to function. The mini is a much smaller hole, so it's a lot easier.
Well, not only is it a lot easier, but the difference in time spent. The conventional implant, I know, takes many, many months for all of that bone grafting to take place. Very significant, isn't it?
Oh yeah, it's a big difference. The mini implants can take only a month, up to a month. The conventional implants can take up to 6 to 9 months. There's a lot of surgery. You have to uncover the implant and then start with the top of the tooth after 6 months. So it's quite a procedure.
And with that, the mini dental implant procedure is something that happens in office, isn't it? So you can work with the patient directly at your practice.
Right. You can do step A to Z with the mini implant and finish the whole case. So you don't have to send out to a specialist or do the multiple steps.
Yeah.
So.
Now let's take a look at a denture. You know, I know that some people that have dentures, that bottom denture is swimming around on the bottom of the gum, and it's so uncomfortable, it's so unstable, it falls out, you can't chew properly. But the mini dental implant procedure will basically stabilize the denture. Show us how.
Yeah, this is how they do it. We put 4 mini implants in the front of the mandible, and then we just take this denture, which has O-rings inside, little rubber rings that snap right into the denture. We can even use your existing denture if it's a good one and just retrofit it. It works really well because most lower dentures just float and they don't work very well. So this is a great procedure for that.
And if you're out there with a denture, I know that many of you probably use that adhesive. That goop is gone. So I can't imagine, Dr. Brown, people who have the adhesive, they end up swallowing it. It gets into the intestine. It must taste terrible.
Oh, yeah. And people smear it all over the place. It's very messy, too. So you don't need it at all. This just completely snaps in, very strong.
So that's the example for a lower denture and how the mini dental implant will work. Now, odds are, if you have a lower, you probably have an upper. But what's significant about this, the sense of taste for all the foods we love is going to come back. And in addition to that, you're going to have a stabilized denture. Dr. Brown's going to show us why.
Yeah, usually we'll put in 6 mini implants in the top teeth, top ridge. And the same case, we've got these little O-rings that snap right into the denture. We can use your existing denture or make a new one, and it snaps right in. So then you have the denture, and it's very nice because it doesn't come out or come loose.
It doesn't come loose. And open that up again and take that apart, because what's significant is the fact that that plastic that's in that place where you're rubbing with your finger, that's all gone.
It's
that
all
plastic
gone.
That's there to keep the denture up. It's sort of like a suction in a more conventional way.
That's where you get some of your taste back. The full denture has to go all the way to the back. And this, you cut it off, so which is nice. So, and you can probably talk better too.
I was just going to say that, you know, with people who have dentures, they have some issues with their speech because of the fact that that plastic is there and it's covering the palate.
Right, exactly. People love this.
So if you have a denture, Dr. Brown will work with you. If you are looking for an even better experience with the mini dental implant, we're going to show you what's called the fixed on 6. And Dr. Brown, there's very little, well, there's no plastic in this, is there?
Yes, no, this is all zirconia. It's regular crown material that dentists use for normal crowns. It's very sturdy
stable
and strong. It's almost strong as metal. And it's got the same thing. We put in more implants on the top or the bottom, but we use more because it stabilizes more. But we still have these O-rings in here, which snap it in, but it's so strong you can't get it out. The patient can't get it out. So we have to be able to get it out once a year, and we'll keep it clean for maintenance. And we sometimes have to use, new O-rings. So, but very good product.
It's a
Works
great product.
Really well.
And
yeah.
so the patient will come to you for their cleaning and for a checkup
Yep.
every year, and
Yep.
you can do an upper or a lower or both.
Yeah, you can do either one. So it's an excellent product, very long lasting.
And that product that the teeth are made out of are, as they used to say, made to take a licking and keep on ticking. They work well to chew food, and not only do they look great, but they function as if,
Exactly.
the teeth are there just like normal.
Yeah, you can chew normal food with this. It doesn't move at all, so it's very good. And then after a year, we'll take it out.
Wait till you see the next example. This is called a roundhouse. Now, if God gave us our baby teeth and our adult teeth, Dr. Thomas Brown is now going to give us our third set of teeth with the roundhouse example.
Yeah, here we do 10 to 12 implants, and we take this same material and we cement it right on. There's no O-rings in here, just cemented on solidly. So it doesn't have any give at all. It's just in there for a lifetime. This is the top product that we have. You've got all the palate. You'll be able to taste and eat as normal.
And it's cemented in, so it's a
cemented in.
permanent
Yeah,
solution.
it's permanent, that's it.
And I know that you have a family history with the roundhouse, and I think
Oh,
our
yeah.
viewers would love to hear this story.
Yeah, I started with my father 10 years ago, and he was losing his teeth, and I said, well, what do we do? So we went with this procedure, and bam, he's 92 now. Still got it in, so it's been 10 years, and he's chewing like normally, which is great, because at 92, you need your teeth.
You need, and
You
you
need your
know,
teeth.
Dr. Brown, it brings up
Yeah.
a good point. If somebody's out there watching in Illinois and they're saying, well, I'm a little older, I don't really want to make this investment, I'm just going to live life as I've been used to living it. They don't need to do that, do they?
They want to be able to eat, live their life well for the rest of their years. I mean, they really need that. It's good for their health. They're not chewing their food. They're not digesting properly. If they get this, they can live the rest of their years, in better health.
Yeah, but
know?
they're probably relegated to soft foods or things
Yeah.
that probably don't taste as good.
right,
So
exactly.
again, biting into
So-
that ear of corn and on all that deep dish pizza and the juicy steaks.
I had a lot of difficulty in eating. I couldn't eat almost anything.
But with these, I can eat everything.
I can eat everything. It's unbelievable.
It was done, over, done. Let's go home and eat.
So it doesn't slide around or move or worry about it falling out.
And my teeth aren't falling out of my mouth. Best thing I ever did. I've eaten it.
I love it. It's life-changing.
Now, the teeth that are in the back of your mouth. The shape of your mouth, everybody, is dictated by those back teeth as well. You want to have a full look, a good look, and those back teeth chew the food. They're the workhorse
Right.
teeth.
These are the masticators, so these are the crushers. So we get people in that are missing all kinds of teeth everywhere. So we have to be able to put these in there, and these minis work really well, especially for the back teeth. So
So if somebody has a partial, this could be a
Oh,
way
yeah, if they
to
got a-
get a better answer.
partial is the metal removable piece that people have. You can get rid of that fairly easily. You just place the minis and cement this right on. Works really well.
I know when we talked before the program, you mentioned that you had a patient who had suffered a fall and had cracked
Yeah.
a single tooth.
Oh, yeah.
But
Yeah.
the mini dental implant will fix the single tooth. Take a look at this.
Yes, this is the front tooth. So we get this where people are falling and cracking their front teeth. We take the tooth out, and then we put the implant right in there, and then we cement this right over as a temporary we can do. So you don't go without teeth leaving the office at all.
It's a very
So
important
it's a
point.
very-
When,
yeah, you
when
can-
you go to see Dr. Brown and his team, you'll never leave the office without
Right.
teeth.
We'll always give you a tooth as a way. So we can take this and put it right in after the extraction. Very
And-
simple procedure.
And that single tooth, whether it's a fall or the tooth itself
Uh-huh.
has a problem or it's an
Mm-hmm.
accident or just some issue, could be anything, you want to look your best. I can't imagine going through life with a missing tooth, how embarrassing that must be. And this is something that's custom made, is it not, Dr. Brown, for the
Mm-hmm. Yes.
patient?
We can make these crowns right there. So we put the mini implant in the tooth, single, especially the front, and then we can make the crown right there same day. We have machines that do that.
And the titanium post that you see is what holds the tooth in place, or the
Mm-hmm. Yeah,
denture. And
right.
the bone grows around it. So
Yeah.
it actually gets stronger the
Yeah.
more that time goes by.
Yes, it integrates into the metal, into the grooves of the screw. So they're very strong, very good. Same success rate as normal conventional implants, so that works pretty well.
And the dentist we're talking to is Dr. Thomas Brown from Family and Sedation Dentistry. We'll get to know him in just a little bit, but write down this address, 1807 South Washington Street, Suite 107. They're in Hawthorne Square Mall. It's a half mile south of 75th and Washington in Naperville, Illinois. We all know where that is, in Naperville. Come on down and give Dr. Brown a visit. And you want to call for an appointment at 630-468-1960. And if you want to find out more, you can go online. Most of us go online to find out about our doctors. You can look him up at drthomasbrown.com, drthomasbrown.com. And of course, check him out on Facebook as well. So make sure you make that call, write that number down, share it with your friends. And now it's time to get to know Dr. Thomas Brown, because we've talked about the mini dental implant, but I think we need to get to know you. Where did you grow up, Doc?
I grew up in the northern suburbs of Wakanda, which is a smaller town. So I grew up there, and then I went into the city I had a track scholarship at DePaul. So I went down there, and there I met my wife. And then from there, I went to the University of Illinois Dental School.
So you are an Illinois guy through and through.
Yeah, I'm sticking in Illinois. I'm going to stay here. I've got family here, and they're all, you know.
Yeah, we'll talk about your family.
Yeah.
We'll talk about your family in a little bit. But
Yeah.
you mentioned you ran track, and I know you're a runner, and a lot of discipline with that.
Yeah.
But
Yeah.
your dad, who we talked about earlier, who you treated with the mini dental implant, tell us about your dad. He's got some significant titles.
Yeah, he's been running since he was 56 when he retired, which is early, but he ran till about he was 88.
Wow.
He had world records all the way up through the years. Pretty amazing.
That's terrific.
Maybe some of them are broken, but he was pretty fast. I don't know how he did it.
How did you get into this practice?
I was good at art, and I started thinking, you know, maybe I'm good at art, but I'm good at science. I thought, how do you combine those two? And then I took a test, and then came out to be dentistry or patent law, and I said, okay, I don't want to be a lawyer, so let's do the dentistry. And then I picked up some mentors along the way, dentists I would visit, and that worked out really well. So then I just kept going, and here I am.
And here you are, 30 plus years, over 35 years you've been
Yeah.
practicing.
It's
The
been good.
technology has changed so significantly, hasn't it, Doc?
It really has. It's hard to even keep up, but I feel like we hear that from patients that, boy, you guys have all the latest technology, you know, and it's amazing.
And I know that with the technology, you work with your team, and your team is very important because your daughter works with you as a dentist.
Yeah, she's fallen right into place, and taught her a lot of things, and she's gone to courses and things like that to study, so she does pretty much what I do. She does the mini implants, and we do all kinds of things like sedation, and we do extractions. We do pretty much everything.
What's it like to work with your daughter?
It's pretty amazing because you get to know them even more than you thought you knew them. And then you, like, oh my gosh, I thought I knew her, but now I'm getting to know her more. It's really wonderful. And you see all the good things how they grew up, the things you taught them, and then the things that they do that you didn't teach them. But there's a lot of good there, you know. It's really edifying to see your own daughter turn out like that and do things, you know, that you taught her.
Oh, it's terrific.
Or that, even growing up as a kid, you know, you're like, wow, this is amazing.
You have quite a large family. How many children do you have?
Yeah, I have 10 children.
10 children,
and,
my gosh.
Yeah, it's pretty amazing. Like, how did that happen? So I have a beautiful wife, and I don't know how she's done it, but we've raised those kids, and they all come out really well. Did want another dentist in there, but I can't quite get it yet. They just don't want to go for that. So, but it's been a great ride, a lot of fun,
and the family's supporting you, of course, and they're all doing well.
Yeah.
I know that here in Illinois, we have all the technology at Family and Sedation Dentistry, but you hopscotch over the Great Lakes to Buffalo, New York, and I know you connect with Dr. Todd Shatkin, who our viewers here in Illinois may not know, but they should, because he is the one who has really crafted the mini dental implant practice. Tell us why you go to Buffalo to get this
I was
information.
looking for something simpler than conventional implants because they're so complicated and so much surgical and for the patients, and so expensive for the patients, and so painful because I see patient coming in with that. So then I saw his courses, and I decided, hey, let me try that and see what he has to say. And it was like mind-blowing. I just couldn't believe it because of what he teaches, what he promotes, and he's got a lab, and he's got the whole package there. So he teaches the mini implants.
And you bring that technology right back here to Naperville. And what's great about this, Dr. Thomas Brown, is that you can do all of this procedure in your office, 1807 South Washington Street, Suite 107, Hawthorne Square Mall. They're half mile south of 75th and Washington. And we should talk about what you do for the patient. When somebody makes the call, and they connect with you, it's a free consultation,
Right.
isn't it?
Yeah, we get them in and we start talking with them. I have a great staff who will talk them through things. I come in and help talk, and then we do a CAT scan there to make sure their bone's okay. Talk with them about finances. We have to make sure they can afford it. And we have a lot of different payment plans, things like that that can help.
You know, most of us are used to paying for our homes with a mortgage or paying
Right.
a monthly fee for our vehicles. And this is an investment in yourself, but it's an investment that's workable.
It is.
Not only is it affordable, you work with the patient, and all of these different plans that you have, your team will work with the patient, because it not only is it an investment in yourself, it's an investment you can't afford not to make.
Exactly.
For everything we just talked about, the health of you as a human being, the look, you're in a new relationship, you're getting a new job, the sense of confidence is going to come back. And we talked about the consultation. You have a very interesting piece of equipment, the 3D cone beam technology. So when you sit down, you're not going to get that gum in your mouth like you used to make the mold, if you remember what that was like.
Yeah.
How does that work, that 3D technology?
Yeah, they sit there or stand, and then just a piece rotates around their head, so it's really very simple. And then that takes their bone density and all their measurements and all their a scan of the jaw. So then we can see how thick it is and where to put the implants and things like that. So we have to get that all ready beforehand. So then we talk about it a little bit and plan it from there.
You're going to find out where that tooth goes.
Yeah, find out exactly where the tooth goes.
Now, sometimes when people go to the dentist, you hear sometimes the fear of going to the dentist. They should not have a fear anymore. The technology which you're learning about, watching Innovations in Health, but you also offer sedation dentistry as well. So there are some patients out there that need that, don't they?
Yeah, we find that's a key component to all this, because lots of people have had bad experiences in the past and they're really traumatized. They really can't sit. Some are shaking, some can't even come out of the car. They're so afraid. They have to get the courage up to come in. So there's a wide variety of that, and we find that sedation really is a good fit, because it's very simple. We monitor the patient, and then they can go through the procedure, and most of the time they can't even remember it, which is nice.
Yeah, so you're able to give them what they need to get through it.
Yeah.
And you'll look so much better when you come out of it.
Oh, yeah.
And you offer Botox. Why do you offer Botox, and what does that mean to the patient?
Yeah, we found that lots of people come in for jaw problems, teeth clenching, so we do that into the muscles here to relax them, and then that really is a major thing, especially with grinding, and so we give them maybe a splint, like a night guard, and we do Botox, and it's a good combination. We also do some aesthetic Botox kind of on the side. People want their forehead and between the eyes and things like that, so we do a fair amount of that.
Yeah, so you're trained and certified in the treatment with Botox.
Yeah.
And as we look at cosmetic dentistry and the minis, which you might want to get to look better, the Botox adds to that process.
Yeah, oh yeah, for sure.
And I know you have a machine that actually makes the teeth right there. So again, made in America product, and this is a state-of-the-art machine that you have right in your practice in Naperville.
Makes it right there. They don't have to waste time coming back. They don't have a temporary crown. They come back and they get it made the same day.
You know, I think most people look at time management. You know, you're out there, and we're, for our viewers that are watching here in Illinois, you're thinking, well, I have a lot to do. I've got my family issues, I got my work, my school. I don't have the time, but the fact that you can do this in office consolidates that time substantially.
Yes, people love it after we do. They don't want to change back to the other way. It's like, okay, we'll just do it.
And we're going to hear from some of those folks in just a little bit, but you don't have to have a life where you're eating soft foods. You don't have to accept the life with a denture that's going to fall out and embarrass somebody at a party. Imagine a family function and the denture falls out. No matter what your age, made in America product, and as we said, by and large, made right there in the practice at Naperville. Let's talk a little bit, Dr. Brown. You've been doing this for a long time. How long have you been placing minis?
Yes, about 10 years. So it's been a while. We've got a lot of experience, and my daughter's been doing it about the same amount of time.
So this is a long, thousands and thousands of mini implants.
Oh, yeah.
What's the overall reaction when somebody has the procedure? What do they say to you?
Yeah, they love the looks of it, if it's front teeth, and even just the back that they can chew again. I mean, some people go for years without chewing, and all of a sudden they can chew like they used to. It gets pretty emotional sometimes.
I bet.
I mean, they're just, shocked.
And when that reveal, because you don't show them too much of the procedure, but when the reveal happens and they see, it's a
Oh, it's
life-changing.
great. They love it. Yeah, so they look in the mirror. We have mirrors there, and it's just pretty amazing.
You know, let's hear from the patients themselves, people who have gone through the mini dental implant procedure and had their lives changed.
I've been wanting to do this procedure for about 20 years.
I had a bad root canal in the past, and I had to get an implant.
I had not really taken care of myself for a number of years, and he laid out a couple of options, and I asked him, let's just go ahead and take the most direct route to resolve the issues, and that's what we did.
That seemed to be like the best option.
It was really the thorough consultation with Dr. Brown.
I remember being very nervous to get it, but it really was no big deal at all.
The procedure itself was actually way better than I expected.
Always relaxed and confident that I was in good hands.
I was extremely happy with actually how simple it ended up being.
Very little pain, and Dr. Brown personally followed up with me after each surgery, and which was much appreciated. And I feel like he and I have established our own personal relationship, and everybody here has been great.
Everybody was friendly, nice, explained to me essentially how the breakdown structure was going to be, what I was purchasing. So very happy with that.
I got a healthy mouth again, and that I can eat normally now, and know that if I have any further issues, I'm in good hands when I come back.
Just having the freedom to be able to just live my life normally and not have to carry that around or worry about, you know, breaking it or falling out has been pretty amazing.
I don't have the same tooth anymore.
You can check out more of those testimonials on Dr. Brown's website, drthomasbrown.com. And we've heard from some of the patients. Doc, when somebody gets the procedure, we talked about less discomfort. What do you prescribe if there's pain or any discomfort at all?
Yeah, I have actually been surprised at that doing all these years, that it really is minimal. It's we use usually over-the-counter medications, you know, but if we have to, we'll go with some prescription. But generally, by the next day or two, people are pretty okay, even with the normal over-the-counter. It's pretty amazing to me.
And Dr. Brown, we should mention too, in addition to the mini dental implants, you have over 12 chairs. You're offering all kinds of dentistry. So if somebody's out there and they're looking for a dentist, maybe looking for a change, or they've met you now in the program and they're thinking, I'm going to go check it out, you have other areas of dentistry that you can help our viewers with.
Right. We found that people want to stay in the same place to get their services done. They don't want to go out to a specialist or anything like that. So we get into most dental procedures.
Yeah, it seems like you're a one-stop shop for so many things, including the mini dental implant, which is the primary focus here on innovations in health. So let's go back to those models. You know, if you've just joined us, you may have missed earlier in the show where we showed these models. If you've been with us for the half hour, we thank you for staying with us. And now you're going to really see, once again, why the mini dental implant is so revolutionary. And it starts with the conventional versus the mini with this mandible example of the jawbone, right, Doc?
Yeah. Oh, yeah. You can see the difference, the size of the hole. That directly relates to pain. You've got these minis, the hole's very small, and you've got the regular implants very big.
And
so
it takes
really,
a while with the conventional implants. Months and months go by, and the minis happening same day in your office.
You can put the mini in some cases we can put the crown right on the tooth, restore the tooth. So it's a great procedure.
Just the size of the hole makes the answer.
Yeah.
For me, I'll go with the minis. Now, if you have dentures, everybody, and I know some of our viewers do, you're used to those bottom dentures swimming around in the bottom of the gum. The titanium post is what stabilizes the lower denture. Show us why, Dr. Brown.
Yeah, so see, we put 4 usually on the lower, 4 of the minis, and the dentures here, and we can even use the patient's denture. So we've got these little O-rings, these rubber rings that are built into this, custom built. So then it snaps right onto the denture, onto the person's ridge, and there you have it. And they're very tight.
Secure and not going to fall out, and you're going to be able to chew and imagine eating the foods we love. Now, speaking of food, the palate needs to be exposed to get that sense of taste. It's now going to come back, and the upper denture example is the most dramatic to show us why.
Yes. So we take the palate out mostly. We put these, usually it's 6 minis in here, and then we have these matching O-rings that we put in the denture.
And that plastic that's in that kind of U shape there is gone. That plastic is there
gone,
to hold the conventional denture, but it's taken out for the mini.
Yeah, this whole palate is taken out. So this is where you get your taste back with this removal It works out really well. And people love it because their tongue can get in there more, and it's, you know, better for talking and things like that. So very easy procedure. We can use your existing denture and make this happen.
Now there's a step up from this, and Dr. Brown has what we call the fixed on 6. And no plastic at all on this, right, Doc?
No plastic at all. This is our normal crowns and bridges material, which is very hard. It's called zirconia, and it
fits right in there, real secure.
Fits right in. This is a snug one. So these have these little O-rings again into this stronger material, but there's less material. It's almost as if it's like normal teeth. You basically snap it in, and then they don't take it out for a year. That's when they come in for a checkup, and we clean it and replace the O-rings, and it works really well. These are very tight. The patient can't get them out.
If God gave us our baby teeth and our adult teeth, Dr. Brown and his team at Family and Sedation Dentistry in Naperville are going to give us our 3rd set of teeth with what we call the roundhouse.
Yeah, this is the most permanent solution. The other one has the O-rings. This is cementable. So we put in 10 to 12 implants here on the upper or lower, and then we take this and we cement it. There's no real O-rings in here. We take this and we cement it in there permanently, and that's it. It doesn't go anywhere.
So that's really is the finest solution on the mini dental implant side. And you had mentioned earlier your dad is the recipient of the roundhouse.
Right. He was one of the first cases that I did 10 years ago when I first started. He had one of these. I cemented right onto his teeth. He still got them to this day, and he loves them. He has no problems with them at all.
Now, if you have teeth in the back of your mouth or a partial and you're neglecting them, don't neglect them, because the back teeth are so important. And Dr. Brown, show us with the mini dental implant how you can fix those back teeth.
Oh yeah, see, so any teeth you're missing, we can take and we can put something in there. Quite a few people have this problem. They're missing back teeth and they don't even know that they can chew better. This is the simplest solution, unless you want to drill down teeth and make a bridge, but that's harder. A lot of people don't want to do that. So you just put these minis in there, take an impression, and then you place this about a month later. Sometimes we have to wait a month. So
it seems revolutionary, and it is. It's the latest technology, and the technology has been around a while. It gets better all the time. And if you have a single tooth that's missing, or it fell out, or you had an accident, the mini will fix it.
Many patients have this happen. They'll have a lot of decay on the front tooth, or they'll fall and knock their tooth out. So we take the tooth. In a lot of cases, we can take the tooth out and put the mini right back in, and then put a crown or a temporary right on, and then we wait a little bit and then put the permanent on. So,
and again, you're not going to leave the practice missing a tooth.
Right.
If you come in to see Dr. Thomas Brown, you're going to have a tooth all the time. The mini dental implant procedure is what Dr. Brown and his team do at Family and Sedation Dentistry, 1807 South Washington Street, Suite 107, Hawthorne Square Mall. They're a half-mile south of 75th and Washington in Naperville. We all know where that is. Give Dr. Thomas Brown a call. It's 630-468-1960, online at drthomasbrown.com. And they're on Facebook, too. Dr. Brown, you've inspired me here on Innovations in Health. And the reason you're a dentist is to help other people, isn't it?
Yeah, I mean, I like to serve other people. That's what I get the most satisfaction out of, with all these procedures and people looking better and chewing better. It really is impactful to me. And I think that's the bottom line.
You are giving people their life back.
Giving it back, and it really is very rewarding.
Well, we appreciate all the work that you and your daughter and your team do at Family and Sedation Dentistry. And thanks for joining us here on Innovations in Health. And thank you for watching. I'm John DeSciullo. We'll see you next time.